Hi, I am Dr. Rashmi Chaudhary, the consultant obstetrician and gynaecologist working in Cloud9 Hospital, Bellandur, Bangalore. Implantation bleeding can be an early sign of pregnancy which happens in almost one-third of the women who conceive. In human being, the fertilization happens in the outer one-third of the fallopian tube. Implantation bleeding mostly happens 6 to 12 days post-ovulation or just prior to the menstrual period. It is not like a normal menstrual cycle. It is slight spotting, pinkish or brownish discharge, which happens just prior to menstruation or maybe in a week's time. It might be associated with some cramps. So when you should seek a gynecologist opinion for this implantation bleeding is very important. Normally this implantation bleeding doesn't have any impact on the developing embryo. There might be slight cramps, but if this cramps or lower tummy pain or backache is increasing, or if you are having this implantation bleeding, some scanty flow is followed by a severe heavy menstrual cycle, then it can be your normal menstrual cycle, or it can be cause of early miscarriages, or sometimes if irregular spotting continues for a week, then it can be a sign of ectopic pregnancy. In those cases, you must meet your gynecologist. In some cases, in cases of implantation bleeding, might be associated with severe pain in the lower tummy. It can be because of associated bladder infections, or it can be some associated coincidental appendicitis. In these cases, you must seek the gynecologist's opinion. Implantation bleeding, like a bleeding which is very slight, scanty, if it is followed by some early pregnancy symptoms like nausea, vomiting, breast tenderness, or some mood swings, then you should wait for 2 to 3 days and then you should go for the home pregnancy test, and you should meet your gynecologist at the earliest, which they will do the needful.